Welcome to Oral Anatomy Hard Tissues. The hard tissues of the oral cavity consist of the teeth and the jawbones. First, let's take a look at the teeth. The mouth can be divided into the mandibular arch and the maxillary arch. The average adult dentition consists of 32 teeth, including the wisdom teeth, 16 on the top and 16 on the bottom. The teeth are named by their location. If you divide the mouth in half and start at the midline, the first tooth is the central incisor, then the lateral incisor, followed by the canine, and then the first and second premolar. The first molar has the largest surface of all the teeth and is followed by the second and third molar, better known as the wisdom tooth. Each surface of the tooth also has a name. The occlusal surface is found on the top of the posterior teeth and is used for grinding and crushing food. The buccal surface refers to the cheek side of the posterior teeth. The distal refers to the area furthest away from the midline. And the mesial surface is the closest to the midline. The labial is the facial surface of the anterior teeth. The incisal edge is the surface of the anterior teeth that are used for cutting and biting into food. The lingual surface is the inner surface of the tooth and can also be referred to as the palatal surface for the maxillary teeth. There are a few systems that are used for numbering teeth. Some common ones are the universal numbering system, which is used in the US. The teeth are numbered from 1 to 32, starting from the upper right. The second numbering system used is the Palmer notation system, which divides the mouth into 4 quadrants, using a symbol, and then assigns each tooth starting from the midline a number 1 to 8. This is an example of how you would write the upper right first premolar. This method is used in the UK and occasional orthodontics. The World Dental Federation system uses a similar quadrant breakdown, but instead of symbols to separate the quadrants, it uses 1 to 4, starting on the upper right side. An example of how to write the upper right first premolar would be a 1 for the first quadrant and a 4 for the number of the tooth, and would be pronounced 1-4, not 14. This method is used internationally and in Canada. Now let's break down the tooth. The tooth consists of 3 parts: the crown, the neck, and the root. The substance that makes up the crown is called enamel and is the hardest material in the body. The root of the tooth is covered in a layer called cementum and has more of a yellowish hue than the enamel. Inside of the outer shell of the tooth, you will find the dentin. It contains microscopic tubules that transmit sensation. Further inside the tooth, we will find the pulp, which carries the blood supply and sensation through the nerves down the root canal. The periodontal ligaments are the main anchor of the tooth from its connection of the cementum to the alveolar bone. They are also shock absorbers for mechanical forces. Now let's talk about the jawbones. The mandible, also known as the lower jaw, is the strongest bone in the face. It houses the lower teeth and is also the only movable bone. It is able to do so because of the temporomandibular joint. It acts as a hinge to control movement like chewing and speaking. The upper jaw, known as the maxilla, houses the upper teeth and forms the floor of the nasal cavity, lower sockets of the eyes, and the roof of the upper palate. And, unlike the mandible, it does not move. The mandible and maxilla contain the alveolar process, or alveolar bone, which surrounds the tooth roots and form the alveoli sockets that the root sits in. If you extract the tooth, you can see the perfect form in the bone where the tooth sits. These are called the alveoli sockets. In this section, we'll be talking about the oral anatomy of the soft tissues. The soft tissues of the oral cavity include the gingiva, the tongue, the soft and hard palate, the lips and cheeks, and oral mucosa, the salivary glands, and today we'll also be including the sinuses into the soft tissue and oral cavity. First, let's talk about the gingiva, better known as the gums. The gingiva is the pink, firm, soft tissue that surrounds and helps support the teeth. It covers the alveolar bone and provides a protective barrier against bacteria and mechanical forces. The gingiva can be divided into three main parts. The free gingiva, or unattached gingiva, which is a portion of the gums that borders the teeth and is 1 to 3 millimeters of free tissue in healthy gums. The attached gingiva starts at the free gingival line and continues to the border of the mucosa. The attached portion of the gums is firmly bound to the underlying bone, providing stability. The interdental papilla is the triangle or pointy area between the teeth. The interdental papilla helps with preventing food impaction. Now let's move on to the tongue, which is essential for taste, speech, and swallowing. The tongue contains fungiform, filiform, and folate papilla that house the taste buds for detecting sweet, sour, salty, bitter, and umami. The palate can be divided into two parts. The soft palate, which is the area that is flexible and helps close off the nasal passage while swallowing. And the hard palate, which is a bone structure which separates the oral and nasal cavities. The salivary glands are important to the oral cavity because they aid in digestion, lubrication, and protect against bacteria. They include the paroidid gland, found on both sides in front and just below the ear, the submandibular gland, located just below the jaw, and the sublingual gland, located under the tongue. Moving on to the lips and cheeks. The lips help with speech, food containment, and facial expressions. And the cheeks are lined with a mucous membrane for moisture and protection called the mucosa. Now, this may look like an abstract painting, but it's actually the sinuses. Now, the sinuses can be considered both hard and soft tissue and aren't part of the oral cavity, but play a big role in dentistry. The sinuses include the maxillary, the frontal, the ethmoid, and the sphenoid. The maxillary sinuses are the largest and are important in dentistry due to its close proximity to the maxillary teeth and possible sinus lifts for implant placement. This concludes a summary on the oral hard and soft tissues. Thanks for watching.